afternoon, everyone. Welcome to our little research review class. Today's research article is Pathology or Treatment of Traumatic Cervical Syndrome, quote-unquote, whiplash injury. This is from the Advances in Orthopedics in February 28th, 2018. Now, in the whiplash literature, most of the really good stuff has been done years ago. So it's nice to see new articles coming out. There aren't that many of them. So it's good to get them and see what they have to say. This one's interesting because they sort of critique one of the major whiplash documents that's come out in the last 20 years, actually this was 25 years ago, called the Quebec Task Force on Whiplash-Associated Disorders. This task force was very slanted towards the insurance industry. They tended to use data from Canada, where they use a lot of the criteria for resolving the injury is whether they went back to work or not. You can, quite frankly, you can get, going back to work has nothing to do with how we feel. So it's sort of an odd criteria to use, but that's what they use in the insurance industry up in Canada to determine whether a case is handled or not. So obviously it distorts the data. And there's some decent points to this Quebec Task Force thing, but in general, it's a negative for the plaintiff industry or people who have been hurt. This article does a nice job surveying the 4 grades of injury, but they also say that, a lot of things have been added since then. So one of the things that they talk about is that most whiplash injuries occur during a rear-end auto accident, but injury can also result from a sports accident, physical abuse, or other trauma. Whiplash symptoms may appear in the absence of any visible injuries, which is a key component because most of the injuries can be internal. All right, I'm not going to go through the grades here for you, but you can assume they're 0 to 4, they get worse and worse. What I did want to review today, though, was talking about neurological symptoms. So this is mainly in a grade 4 situation. And they talk about migraine headache, tension headache, cervicogenic headache, temporomandibular joint derangement, greater occipital neuralgia, and third occipital headache from the C3 nerve root. So your occipit's the back of your head. So you can have damage to the nerve which comes out the back of the head, and that's occipital neuralgia. Occiput headache, there are several nerves that come up through that area, and when the muscles go into spasm, they can cause a headache type condition. Interestingly enough, they said that symptoms such as dizziness, tinnitus, headache, memory loss, swallowing, and temporomandibular joint pain can appear in any grade of injury. One thing that I find fascinating in here is they talk about, say, most typical symptoms of traumatic cervical syndrome are neck pain, cervical discomfort. Neck pain occurs in 65% of the patients after 6 hours, 93% of the patients within 24 hours, and 100% within 72 hours after neck injury. I don't quite jive with that. I've had several patients over the years who, even days, weeks, even months later, have pain from whiplash injury. And just today I had someone come in, young guy, got hit 2 weeks ago, and just the neck started flaring up this week. So, that's not a 100% rule, hard and fast rule, I would say. Factors that influence the extent and location of injury include vehicle speed, impact direction, use or non-use of safety equipment, and the prior state of the victim's cervical spine. Those are all great points. I think the last one's probably the most important of the bunch. You can have someone with a great spine get in a car accident and walk away and not have any problems, whereas someone's got arthritis or previous degeneration, and you're going to see big problems even with a small accident. I can speak to my own experience. I was sitting in my car on a side street in Boston, and some guy backed out of a parking space right into my car, and totally shocked, but it was a side impact. And, my neck was like screwed up for the next couple of weeks. Now, I've been in several car accidents myself, so my neck isn't the best in the world. And it definitely messed me up for a couple of weeks, and it was a low impact, and I was surprised. But again, my cervical spine does have previous arthritis in it from those previous injuries. So that's a good point. Typical clinical characteristics of the injury include patient not complaining of neck pain immediately after the accident, but then complaining of neck pain a few hours on the next day. Again, it could be later. A nice point they do make is that the time lag can be explained by synovitis or inflammation of the facet joints, where the synovial tissue involved in the facet joint has been damaged by non-physiological behavior during collision, which may induce synovitis, again, irritation of the facet joint after several hours, leading neck pain and limited range of motion. The other part of that formula is the inflammatory process. The inflammatory process really gets going typically after 72 hours. Right? The first phase of healing and injuries, the inflammatory process, is the first 0 to 72 hours. The next phase is the regenerative section, and that's from 6 to 8 weeks. And the last phase is the remodeling, which is up to 12 to 18 months. Many patients with traumatic cervical syndrome recover from the symptoms within a few weeks or months, but 20 to 40% will have neck pain and headaches that continue for several years, and 3 to 4% will be disabled and not able to return to work. The potential exists for abnormally prolonged arthritis of the synovial membrane, cervical nerve root irritation of the posterior branches, and vestibular reflex abnormality due to vestibular dysfunction, neck muscle tension, or fibromyalgia. So your vestibular system is your balance system. All right, obviously it's a critical component. And they do talk about in this article some detailed information about that. We talk about headaches. Headaches present chronic symptoms in 70% of patients after whiplash. There's a connection between the upper spine nerve roots and the trigeminal nerve. Dizziness, they talk about. There are 2 types of dizziness. There's vertigo, which can be caused by brainstem bleeding, sometimes manifests as vertigo, but in fact it's mostly caused by an inner ear disorder. And then planktonic. Planktonic dizziness is caused by a cervical cranial disorder, of failure of the input system regarding the spinal cord. So the planktonic is going to be more spine related, whereas the vertigo could be inner ear related. Dizziness originating from the cervical spine is collectively known as cervical vertigo and may be caused by circulatory failure of the vertebral artery, proprioception dysfunction of the cervical spine, or cervical sympathetic nervous system disorders. Cervical and lumbar proprioception dysfunction may produce vertigo. Barré-Lewis syndrome. Barré-Lewis syndrome symptoms include headache, dizziness, and other cervical sympathetic nervous system symptoms. Numbness in the head and the face. This is disruption of the trigeminal spinal nucleus can lead to numbness or loss of sensation around the face. Eye symptoms. Eye symptoms emerge in 35% of traumatic cervical syndrome patients. It could be eye pain due to trigeminal nerve stimulation, eye movement disorder, double vision caused by oculomotor nerve dysfunction, visual deficit due to optic nerve disorders, and I'm not sure how to pronounce that, blepharostosis due to sympathetic nervous system disorders. Nausea and vomiting are found in 17 and 29% of whiplash injured patients. These symptoms persist for more than 6 months in a third of patients. Limb symptoms, numbness or muscle weakness of the upper cervical extremities may appear as nerve root or spinal cord symptoms. It's most commonly seen in people who have disc injuries and pain in the shoulder blade area. That's a really, very common symptom in the whiplash area. Limb symptoms of traumatic cervical syndrome often do not produce any findings on imaging studies. Motor evoked potentials should be performed in all patients with persistent pain, even in the absence of objective neurological signs and non-significant changes on imaging. I do find that a lot of people have muscle weakness. Sometimes the doctor needs to be very astutely aware, very sensitive. Example, I used the young man I saw today. He had some weakness in his arm. It was definitely some weakness there, but it was very subtle, you know. And I said to him, "Does that feel a little weak to you?" And he says, "Yeah, you know, I was wondering if you noticed that." So again, I'm going to leave that to the quality of the exam in many cases. Fibromyalgia may occur in 21% of patients. Fibromyalgia is a neurosensory disorder characterized by widespread muscle pain, joint stiffness, and fatigue. And there's also no inflammatory findings or abnormalities which indicate organic disorders such as bone and joint disease, neurodegenerative diseases, rheumatic diseases, or malignant tumors. Other common symptoms of fibromyalgia include irritability, sleep disorders, anxiety, depression, and are predominantly seen in women in their 50s, but obviously not 100% of that. The mechanisms of the following symptoms were clear: ringing in the ears, hearing loss, insomnia, loss of concentration, fatigability, fever, memory loss, temporamandibular joint pain, and angina-like chest pain. The Quebec guidelines may not be applicable in all patients for traumatic cervical syndrome. So, nice little article, talks about some of the focuses on some of the weaknesses of the Quebec task force. Again, it's wasn't a great document to begin with, but obviously there's some weaknesses exposed in this article and many others. So, good to keep in mind. I guess the key point here is that whiplash can cause many different problems, symptoms in patients, and it's really important to get a really good, thorough exam when dealing with these patients. In my experience, I've seen a lot of stuff gets missed. I particularly see that in the younger age group. You got to be really on your game with those patients to make sure you're getting all the details. All right, and obviously that's the number one job in my profession, is to get you the details so you can make a stronger case. All right, thank you very much, and we'll see you next time.